Hello, everyone, and welcome to Softfield Academy's webinar. We are very, very glad to welcome all of you tonight. And of course, a very warm welcome to Dr. Nina Bal, who is with us. It's the first webinar with Softfield Academy. So very welcome, Dr. Bal.
Thank you so much for having me.
So I will just give you a little bit of details on the webinar. This webinar will last approximately an hour. You can ask all of your questions in the Q&A or in the chats. Don't hesitate to ask questions all along the webinar, and we will ask all of the questions at the end of the webinar. This webinar also is being recorded, so if you have to miss any part of the webinar, there's no problem. It will be posted on our YouTube page from tomorrow. It will also be on Softfield Academy's website. The webinar will also be subtitled in French, Spanish, and German. So I think I gave you all of the information necessary. Now, I want to give you a little bit more feedback and information on Dr. Nina Bal and her path and her career, and why is she so perfect to speak about cannula injection. So could you please switch slide, Dr. Bal? So Dr. Nina Bal is a cosmetic dental surgeon. Her services include restorative cosmetic dentistry, facial aesthetic treatments and aesthetic medicine, non-surgical cosmetic procedures, and non-surgical facial rejuvenation treatments. She's a member of the General Dental Council and also a board member for Safe Face and the International Academy of Advanced Facial Aesthetics. You might recognize her from TV, as she's part of several UK TV shows such as Body Fixers on E4, This Morning Show with Holly and Phil on ITV, and also from BBC News. So Dr. Nina is the winner of highly commended Aesthetic Doctor of the Year 2022 at the Safety in Beauty Awards. She's also the Private Healthcare Awards 2021 at Best Aesthetic Facial Sculpting Specialist, and the 2020 Global Excellence Awards for the most outstanding facial sculpting treatment, among several others. So Dr. Nina is very passionate about enhancing a patient's innate beauty. Her philosophy is less is more, and she loves to make subtle aesthetic tweaks that lead to excellent yet natural results, which completely fit with our philosophy here at Softfield and with all the results that cannulas and all of our products can achieve. So we are very excited to hear more about her presentation tonight and to hear about her approach to facial architecture using micro-cannulas. I will now give you the stand, Dr. Bal. You can start your presentation, and again, we will answer all the questions at the end of the webinar.
Thank you very much for the lovely introduction, and good evening, everyone. I hope you can see me, can hear me okay. I am thrilled to be here tonight and to be able to share what I've learned over the last 13 years of doing facial aesthetics and over 15 years as a dentist. So my talk tonight would be around my approach to facial architecture using the cannulas. So I am Italian. I'm full Italian, although I live in London at the moment, and I've been living in London for the last 12 years. So let's dive into it. So if you don't know me, my name is Dr. Nina Bal. So I am a cosmetic dental surgeon. So my background, very proudly, is in dentistry. However, I don't practice dentistry anymore. I stopped in 2020 with the pandemic, and I've been doing non-surgical facial aesthetics now for over 11 years. So I started quite a while ago when I first moved to UK. So, and that's my passion. That's what I love. And I think I truly believe that whatever you love doing, success just comes and you become better. So my heart wasn't in dentistry. It is in aesthetics very much so. But I'm so proud of being a dentist because as I'm going to show you during my presentation, that allows me to see aesthetic with a dentist's cap. And that is really, really useful. And I'm going to show you why. So my clinic is in central London, in Belgravia, in the very heart of London. And that also comes with, very high expectations from clients, very high-end clients. And that's why soft fill cannulas are ideal. And again, I'm going to explain why as well. So just to be super clear and super transparent, I'm a KOL for soft fill cannulas for Revanesse, hyaluronic acid, selenium, and also for Lutronic. During my presentation, during the videos I'm going to show you, I'm going to be using some Revanesse product and also guanfioxane. So the way I assess my patient's face during my aesthetic consultation has changed massively over the years. And I think now the way I do it now is obviously it's a combination of experience, knowledge of aesthetics, beauty, medicine, and dentistry. So, and really allows me to analyze my patients not only for the aging process and advise them regarding the most suitable treatment plan for anti-aging or targeting the signs of aging that bothers them, but equally also lots of patients come to me for facial structure. So they say a classic line they say to me is, actually, I'm not really sure why I don't like my face shape. There's something off. I can't really pinpoint. Can you help me? So normally my consultations for literally almost every one of my patients is dual, is around anti-aging, but equally face structure. How can I hide or correct aesthetically a skeletal or dental malocclusion? So first thing I do when I clinically assess my patients is to analyze the facial third, because that is straight have an idea where, if there is an imbalance, where it is. So I use personally a ruler in my practice. I used to use a very fancy caliper, which is, the patient love it. But you can get the same measures for the same purpose just with a normal ruler. So whatever's best for you. So I can analyze the three thirds. So I go firstly for the upper third, which goes from the hairline to the glabella. Second third, from the glabella, the subnasal point, and then from the base of the nose up to. Now, as you probably straight away can realize, the only third that we can actually play with is the lower third, but equally the one where the malocclusion show. So already by measuring, I realize whether the patient lacks of vertical dimension. And so very often when a patient has a deep bite, so the teeth close too much, then already in the lower third will be shorter. So already in my head, I can treatment plan and think, okay, maybe we need to increase the length on the lower third. Same thing I do for the side profile. So side profile balancing is one of the most popular treatments I do in my clinic. Again, I use a ruler, and what I do, I analyze my main focus is on the lower third. So I personally treat the mid and lower third with the cannulas. As a personal decision, I don't treat the upper third. Again, the more I get experience, the more patients I see, the more complication I've seen on myself and on my colleagues, and the safer I become. And that's why, again, soft fill cannulas are essentially my practice. So when I analyze the lower third in the side profile, again, already I start to have a clear idea of the kind of occlusion that the patient has dentally and skeletally. And so again, I start to treatment plan. So that's where my dentist cap comes on, and it gets really useful in my facial aesthetic treatment planning. So the ideal occlusion is called the class 1, which is the one in the center. So I'm not going to go into much detail about the dental occlusion because it doesn't really affect us about aesthetics. However, most dental malocclusions, if not treated in a young age, can also, and then again, if not treated while we are growing up, then the skeletal malocclusion of the bone structure and the soft on top of them becomes more and more apparent. And with the aging process, there's no, so if there's any sort of malocclusion, which when you're young you can get away with it and not being very obvious, by losing elasticity with the aging process and losing volume, everything shows. If there's a crossbite, which means if your midline is not centered and your chin goes on one side and the teeth goes on one side as well, again, you might not notice much when you're young. When you get older, you have asymmetrical jowls. So again, first thing I do is always look into the mouth. With the class 1 occlusion, essentially what I'm looking for is the line between the lips and the chin. So I don't really look into the mouth in that case, but just with my ruler again, I place my ruler and I say, okay, this is a class 1. So I know already that if someone, let's say, comes requesting a chin filler, let's say, however, there are a class 1 on the side and the 3/3 are the same length, I'm saying, I'm sorry, I'm not going to do it because I know it will give them a too much elongated chin, a pointy chin. So always refer back to the malocclusion. The class 2 is the most common malocclusion. It's the most also treatable, which is good. So essentially what's happening in a class 2, the maxilla, the bone of the aptive is over-projecting. So the patients present a side profile with a retrognathic mandible and over-project maxilla. So as you can very clearly see from, if I draw a line like this with my mouse with the arrow, you can see that the profile is convex. So there's often this patient have an over-projecting dorsal hump in the nose and a very weak chin, over-projecting upper lip. Again, so as you can intuitively treatment plan them just from this picture, this kind of patient needs a projection of the lower lip and projection of the chin. Typical case where if someone is a class 2 and comes to me and requests an upper lip filler only, or they say, I really want to have a much bigger upper lip, I'm like, I'm sorry, I'm not going to give this to you because it's going to make your side profile, your class 2, much more obvious. And so what I do, I often, depends on the severity, either don't touch the upper lip or do just lower lip and just a projection on the chin. Sometimes they need a combination of nose reshaping and chin as well, but the issue is not the nose per se, it's just the position of the chin. The class 3 is opposite, is a prognathic mandible, overdeveloped mandible, and a retrognathic maxilla. So the side profile in this case is concave. So again, just from seeing this photo here, what do we need to do? We need to create projection in the upper lip. So obviously we can't shave off the bottom lip, we can't shave the chin. However, we can increase the projection of the upper lip, and that just doing that subtle tweak with my 25 gauge cannula, you balance the side profile. So although we can't correct it, we can really effectively hide them. My choice are the soft fluid cannula. There's many reasons why I love them. So there's 2 kind of them. So there's the Easy Guide, which are the ones I'm going to talk about in a second, and the Precision as well. So I use both. The Easy Guide are very easy. I wish you guys gave me those when I started my journey 12 years ago. My life would have been so much easier. So essentially, the reason why they're called Easy Guide is because there's these kind of butterfly which contains pre-hole needles and a guide for the cannula. So essentially, you just do the entry point using this tiny butterfly, you leave it there, and then I'm going to show you in the video, the cannula super easily slides here. So you don't need to look for the hole. Everything is made for you. So